The CDC is under fire again, this time for withholding information from the public about the COVID pandemic. According to a New York Times investigation, the CDC said the information wasn't ready for prime time.
The investigation raises questions about what specific data was withheld and why. It also further erodes the credibility of the CDC and its capacity to keep the American public safe. Medical reporter Lori Johnson brings us the details.
The investigation found the agency responsible for helping Americans weather the COVID pandemic has only provided a small amount of the vast data it's obtained. Areas of this withheld information include COVID hospitalizations, including age, race, and vaccination status, the efficacy of boosters among 18 to 49-year-olds, the group least likely to benefit from the shots, and COVID levels in wastewater systems in various U.S. communities. While the CDC has not yet responded to CBN News, a spokesperson told The Times in part that the information was not ready for prime time. The CDC's Kristen Nordland added the agency must ensure details are accurate and actionable. She also admitted concern the data might be misinterpreted, such as vaccines being ineffective.
This is terrible. I mean, this is bad news.
Political analyst Nathan Gonzalez told CBN News Faith Nation this only adds to Americans' skepticism of government.
Now that we're this far and we're 2 years into a pandemic and we get this story from the New York Times, it just creates even more distrust.
He sees one way the CDC can rebuild that trust, tell Americans the whole truth.
Give out more information, but put it in proper context. Give people the tools to know how to use the information in order to make the best decision for their lives and for their family.
Former FDA Commissioner Dr. Scott Gottlieb says the CDC essentially failed its objectives, communication, and guidance.
So we didn't have an organization capable of doing that. We sort of surmised that CDC would be up to that task, but it wasn't.
He says the CDC has a reputation of being slow at processing and sharing data.
We need a better capability to gather and disseminate information in a real-time fashion. CDC really wasn't up to that challenge.
Gottlieb says moving forward, the agency should present all relevant data.
Consumers could look at it and say, okay, this is what I need to do. This is what the agency is telling me based on this evidence.
So while the COVID-19 pandemic presented never-before-seen challenges to America's top health agency, critics say it should learn from its messaging mistakes and pivot before the next health emergency. Lori Johnson, CBN News.
I think one of the top things they need to do is get the politics out of it. Just inform the public on the medical facts, the medical guidance, and leave the politics way behind. It's become remarkably political, where they're looking at their data and saying, is this likely to be misinterpreted, and therefore we're not going to release it? Well, that's not a free and open society. You don't get to judge that. You get to say, here are the facts that we're having from the field. This is what is happening. And then let the truth come out and quit worrying about how it's going to be spun. That's really not your job. Don't play politics with the information. Don't play politics with medical guidance for the public, because all that does is increase the suspicion that you're withholding vital information or you're misguiding people, and that causes everything to shut down. You have to stay first and foremost true to the data. If you do, then everyone will trust what you release and trust what you say. If you don't, then the trust is going to evaporate and you're not going to be able to rebuild it.